Um, Also, go outside the treatment centers for your research. Sticking inside the treatment centers basically guarantees that your research is going to be skewed in terms of demographics and the type of people that are there. Also, acknowledge the intimacy that we need. Be an advocate for us. Utilize love languages. Often, we have that voice beating in our head all the time. You're worthless, you're ugly, you need to diet, all that kind of stuff. You need to lose weight. Use the love languages. Even something as, a platonic touch on the hand gets across so much more than talking hours and hours of therapy. If nobody ever has touched you on the hand like that before, that can be the moment where you finally realize, hey, I am worthy of having somebody touch me. I am worthy of intimacy. There is concern that crossing that boundary, especially with the physical intimacy like that, that crossing that boundary with the therapist and the patient is a very bad thing because it can spark, abuse triggers and all that. If a therapist is very forward about it and says, this is the intent of what I'm about to do right now, is it okay? Ask permission, if you intend to do that. Explain your rationale for why you're doing it. I think if you can do that and explain what your purpose is as a therapist to do those love languages, it can speak so much louder than hours and hours of rationalization because of that voice. It speaks louder than that voice. People tell us things all the time, but they don't often, embrace us or any of the other, love languages like giving gifts that are personalized. Those are things that aren't done very much in therapy. If they are done, it's by the more liberal therapist who decides to take a risk, and I really applaud that because I understand how beneficial it can be for somebody who really needs that extra little touch. You do need that model for intimacy, especially if you have been abused, and the therapeutic setting is probably the safest place where you can model that and say it's okay to touch. So I think it's a good thing, within reason, of course. You can monitor your sessions, to avoid impropriety and things like that, whether or not it's, taping the sessions with permission or having a third party with permission in sessions, recording, that kind of stuff. Also, specialize the programs in terms of gender and need and age, that kind of thing. Somebody who is a 45-year-old male, they're not going to have much in common with a group of adolescent females who are all 16 to 18 years old or what have you. The life experiences are going to be very different. The attitudes from male to female are going to be very different. The reasons why they have the disorder are going to be very different based on their gender and age. So there needs to be a slightly different approach based on who is within the treatment center. And currently, a lot of treatment centers do specialize, but it's not done enough because it's based on how much funding do you have for staff, how many programs can you operate at one time, and that kind of thing. So there's a need for that. Also, it's a good idea for therapists to establish takeover contracts. Compulsory treatment is one of the most debated aspects of disordered eating. Where you force a person to get a feeding tube or go into the hospital. If you as a therapist establish a takeover point where you say, if you lose X number of pounds, we will have to admit you into the hospital, and the patient will agree to this, then the patient has some respect that they keep, where they say, yes, I acknowledge that you can do this. And so you don't violate their autonomy like that by just coming in automatically and saying, you're going into the hospital automatically, you're too thin or whatever. So you respect them and you ask them what they want to do, and they know ahead of time. There's no surprise to it. They understand that there's a consequence. If they reach a certain point, you're going to do that for their best interests, and they've agreed to that. Also, don't say that you're going to fix somebody who is eating disordered. That, to an eating disordered individual, implies that there is something wrong with them, and they will just use that as, more fuel for the eating disorder voice. They will take that as, oh, well, I need to be fixed. I'm bad. I'm, worthless or whatever. So under no circumstances say that. Instead, just say that you are going to be there for them, that you want them to be healthy, those kinds of things, those positive things. There's also a need for significant treatment follow-up. There needs to be a required follow-up standard. Currently, it's recommended that people get followed up, but a lot of times it's not practical, or people lose touch with the center, or that kind of thing. It needs to be required that within a certain amount of time that they do have a follow-up, and for so many periods after that. Also, a system might help where a person gradually leaves the center. Right now, most of the time, you're in a treatment center for a particular amount of weeks or months, and then you're released, and you're back out into the real world. That is probably one of the worst things that happens, because you're essentially shocked back into real life. The stresses that you have within the center are very different than the stresses that you have outside. And so you need to have a more gradual transition back into that. So that is one way that you can monitor how a person is doing. Gradually let them go outside the center a little bit at a time. If they were taking a class, let them enroll in one, or whatever, if it's right near the treatment center. So there's a need for that. Within that idea, there's also a need for what I would refer to as respite centers. Right now, you're either an inpatient or you're outpatient. There is no real in-between, where if you need a week to collect yourself, you don't need another 3 months of inpatient, but you need more than what the outpatient can offer you at that point in time. There's no middle ground, and there needs to be centers or ranches or what have you, where people can go for just a little while to get themselves back on their feet and recuperate and just take a rest mentally if they need that to help their recovery and make sure that they don't slip back the other way. Also, there's a practice in a lot of treatment centers of allowing the patients themselves to keep a tally of how much they eat every day in terms of calorie intake, fluid intake, that kind of thing. And a lot of times that is done because the center is understaffed. It saves time because the nurses or what have you don't have to make those recordings. The problem with that is that as long as the person with an eating disorder has a number to work with, they will automatically seek to do away with that number. If they ate 800 calories one day, they'll want 700 and one less than what they had before. So it's best if they don't know. The staff should be accountable and just give the patient the amount that they are supposed to have based on their program. But they shouldn't be allowed to tally for themselves. It forces the patient to still concentrate on numbers. Related to that idea is the idea of the leveled meal system. Currently, when you go into a treatment center, imagine the scene. You have 20 anorexics all in one room, and they're all expected to sit around the table and eat this meal, and nobody's eating. Because in a treatment center, to eat normally is to be abnormal. So if you start eating, you're the odd man out, and that's not what you want. You want to fit in. You want to belong. So putting people together when they first enter the treatment center basically invites that they are not going to eat, or that they will have difficulty. So what I would suggest is, as I said, the leveled treatment system, where when you first come in, you're only eating with one other person, maybe a staff member. You add another person, and so on and so forth, until gradually you feel comfortable being in a communal dining center. And because that way, whether or not you eat is not determined by what everybody else is doing and the mob mentality. It's determined by how comfortable you are with your own eating habits.